Ahoy and good morning, everyone. My name is Josh Bovard, and I am a clinical exercise physiologist here at Copeman Healthcare Center in Vancouver. If this is your first time tuning in to our Walk and Talk segment, welcome. For those returning viewers, welcome back. Today, I'm very excited to have on Dr. Sarah Clouthier. She's one of our family physicians out in Calgary.
Hi, Josh. Thanks for having me.
And yeah, we're going to talk. She's going to share some of her background, both how she got into medicine and what she's doing for medicine these days. And then she's going to share some expertise specifically about the immune system and what you can do to optimize your health and well-being. So best of all, she has promised me that she is also going to walk on the spot with us. So if you haven't started already, we're just going to get walking. I know for me, it's just going to be a nice, easy walk to start off here. I was out for a run this morning, so legs are a little bit sore. And maybe with that, when we think, the last few sessions we've done high-intensity intervals. And so often we think about intervals just within a workout. You want to go for a few minutes hard and then a few minutes easy. As I stressed a few episodes ago when introducing intervals, we kind of want to make our hard sessions hard and our easy sessions easier, our hard parts hard and our easy parts easy. And so we shouldn't only think about this in the context of a single workout, but also in between workouts. So we want to do some intervals on some days, and then we want to just keep them to easy workouts on others. So, and even taking one step further back from that, we want to think about intervals on the scale of weeks. So some weeks we're going to do easy stuff, and some weeks we're going to do harder workouts. So this is called the bigger concept of periodization, which is one of the main principles that we use when prescribing exercise. And so today we're going to have one of the easier days where we're just going to walk on the spot at a light to moderate pace for 30 to 40 minutes and keeping it to that easy intensity. Now, as usual, a few tips and reminders as we get started. First and foremost, we always appreciate that you're joining us to get some exercise, whether it's in the context of your own home while practicing physically distancing, or maybe you've decided to take this virtually and you're listening to it while maybe walking outside, enjoying the beautiful sunshine that we've got. In any way, we appreciate that you're practicing physical distancing and keeping everyone safe. As always, everyone's safety is our top priority. So by participating in the workout, you're acknowledging that you're both physically and medically fit to fully participate. But if you have any concerns about your physical or mental status, or if you've had any recent changes to them, please don't hesitate to contact us, because we want your activity to be both enjoyable and safe. Now, second, just a reminder, you can walk on the spot. Maybe you're on the treadmill, might want to do a little bit of running on the spot, stationary bike, elliptical, or as I said earlier, maybe you're taking this outside to have a physically distant walk. Whatever works for you, just as long as you're walking and moving, that's all great. And then just follow along to what I say and to my cues to keep that intensity at a light to moderate pace. Now, for those walking on the spot with me, a few reminders. First one, wear your comfy shoes. I've got mine on. The second, consider walking on a soft surface. So as I've said before, I walk on a bunch of towels. I look down to make sure those don't move and that I don't trip. But walking on that softer surface can be a little bit easier on the joints. On the flip side, it can make things a little bit harder to balance. So for that reason, you might want to be close to a wall, have a chair or some sort of surface in front of you that you can hold on to should you lose your balance or not feel quite supported. The other one is technique. So I've stressed posture and good walking technique, because good technique is so essential, not only to maximizing the benefit of the activity, but also to minimizing your likelihood of injury. So some things that I've stressed, whether you're walking on the spot, running on the spot, even if you're on the treadmill, elliptical, walking outside, or whatever you may be doing, think about getting your head up nice and tall, shoulders back, chest nice and high. Engage those postural stabilizing muscles or that core by doing, my two favorite cues. Imagine you got a brace for a punch and you got to hold a P. That'll get those abdominal and those stabilizing muscles engaged. Now, once you've got your head up nice and tall, your shoulders are back, your chest is high, you're engaging your core and incorporate that arm motion. So opposite arm, opposite leg. And really, if you move the arms, the legs are kind of going to follow along. So if you need to start a little bit more slowly to get the proper technique, please do. And really just try to train that arms with the legs. And then lastly, for whatever pace or intensity you're going at, just find that balance between lifting your knees up nice and high and turning over or stepping faster. So since we're keeping things at a light to moderate intensity pace today, throughout the session, you might start breathing a little bit harder. You can find that I'm breathing a little bit harder at some point, but you should at no point have any difficulty talking. If you find saying a sentence that's difficult, then you're probably going a little bit too hard than what we want to, or how hard we want you to go just for today. But at all times, listen to your body. If at any point the activity starts to feel uncomfortable or unsafe, just stop. Don't hesitate to contact us. And remember, if you're concerned about your balance, make sure to have that chair or some surface in front of you for support, or the wall beside you. Now, speaking of listening to your body, today we're all going to talk about one of the body's really important systems, the immune system, with Dr. Sarah Clouthier. So I'm going to let her introduce herself, but I did want to point out that she actually started with a background in human kinetics, so a background in movement, which we're doing today. So I wanted to highlight that, but Sarah, I'll let you finish off and talk to the rest of your background and what you're up to now.
Sure. So I'm going to start by saying how grateful I am for this exercise, because I did not get out for my morning run this morning. So awesome to be able to incorporate some movement with work today. So like Josh said, I started in human kinetics and health science. So prevention is sort of at my roots. So I did that in Nova Scotia, then went to McMaster University in Hamilton for med school, and did family medicine residency in Ottawa. And then I worked rurally for 4 years before moving to Alberta to join Copeman. And like Josh, sort of prevention is at my roots. So the longer my journey in medicine is, the more I sort of am going back to where I began and realizing that how we live our lives, the things that we do every day, the decisions we make, our mental state are really what determine our health. So I'm super happy to be here and be chatting about this now. And right now I'm actually doing a fellowship in integrative medicine, so sort of pulling all of these ideas together with Western medicine so that we can really focus on preventing disease in first place rather than just reacting to it.
Oh, that's fascinating, and it's always nice to speak to a fellow. I guess in some ways you are a student if you're going, you're finishing your course and going through your fellowship while practicing.
Absolutely.
It always makes for a never-ending amount of work. But before we start diving into the kind of what you've been learning about with mind, body medicine, integrative medicine, preventative medicine, and the immune system, when we were talking a little bit before, you mentioned that you had a couple dogs. So, biggest question, what type of dogs do you have, and why did they not get out for their morning walk today?
Oh, well, they got out for their morning walk for sure. That doesn't get missed, but we just didn't run this morning. So I have a Samoyed, so a big white fluffy dog, and then a little husky cross. Oh. So they're super active. We don't miss days. We get out several times a day, or my house would be destroyed.
Well, I'm sure, yeah, the nicer weather is real good, and the pros and cons of the nicer weather for them, but nothing like the good morning walk. I know got my dog out for the morning walk, and so he's sleeping peacefully. I'm waiting for the day when he interrupts his walk and talk with a couple scratches on the door. But until then, we've been doing okay. Anyway, let's get to the topic. So let's start, for a lot of our viewers may not actually know what the immune system is. So can we start, Sarah, can you start by just defining what the immune system is and help our viewers understand what its function in the body is?
Yeah, absolutely. So our immune system is our body's defense system. Its functions really to keep us balanced and safe, and it does this by eliminating threats to our health and well-being, such as growing cancer cells, dysfunctional cells in our body, and external threats, such as viruses and bacteria. It's really our protection.
Yes, and it's interesting that you speak to it. It protects against both things that are internal, like, cancer is something our body defends against, and like viruses and bacteria, and obviously there's a certain virus that's a lot of the news these days. But before we get to that, tell us a little bit more about how the immune system works exactly as the body's defense system.
Sure. So it's an incredibly intricate system, and it involves many different cell types that work throughout the entire body. And there's three main lines of defense. So the first line of defense is our skin and our mucous membranes. So the mucous membranes line our respiratory system, so our nose and our lungs. And it also lines our gut, starting with our mouth and going all the way to the anus. And it's literally a physical barrier system that prevents external invaders from entering the body. If a pathogen is able to get through that first line of defense and come into our body, the second line of our immune system kicks in. And we call this the innate immune system. It's a really non-specific rapid responder. And I think of this part of the immune system like calling 911. So if you have a medical emergency, you call 911, and you probably just need the ambulance to show up, but everybody comes with lights and sirens on. So the fire department, the police, and the ambulance. So it's like a full-blown response. And this innate immune response results in the signs of inflammation that we all know very well. So swelling, redness, heat, pain, sometimes fever. If this line of defense isn't enough to combat our threat, then the third line of the immune system, which is called the adaptive immune system, comes into play. And this is a much more specific and tailored response. And as such, it takes a few days to actually kick in because our body has to generate specific and appropriate cell lines based on whatever it's trying to fight. The really cool thing about this part of the immune system is that after it's eradicated the virus or whatever offending agent it's working on, the majority of these custom-made immune cells die off. However, a specific line of the adaptive immune system called memory cells persist in our body. And these memory cells are what provide us with protection the next time we encounter the specific virus or bacteria.
That's really fascinating stuff. And so, as you said, we've got this first line, which is the physical barriers, like our gut and our skin, or the line of our gut, should I say. We've got a second line, that's quite generic. And I really like your analogy of the 911 or the first responders call and how that second line just causes that general information. Then we have the third line, which is the memory system. And I think it's relevant to briefly mention why that third line of defense is really relevant in our current COVID situation today. Can you speak a little bit more to that?
Yeah, absolutely. So because COVID-19 is a novel form of coronavirus that humans have not yet been exposed to, our bodies don't have any memory cells for this virus with which to protect us. So if we encounter the virus, we really have to go through all three stages of the immune response. So it has to penetrate our skin or our mucous membranes. We have to have an innate response. And then we have to produce the adaptive response. And this can take weeks, and it results in all of the symptoms that we're hearing about. So fatigue, inflammation, secretions, and pain and fever in variable degrees, depending on people's immune or health status. And so this is why social distancing and hand washing is really the only way right now to prevent rapid spread and widespread illness until we have a vaccine available. Vaccines really work by taking advantage of the adaptive immune system. So we inject a small amount of normally inactive, but always harmless virus or bacteria into our bodies. And this exposure stimulates a small immune reaction, which allows us to develop those memory cells for that specific virus or bacteria. So once we have those memory cells, it means that if we encounter this particular virus in the future, our bodies will recognize it and will be able to mount a really quick response and prevent us from getting sick again.
Yeah, and going on that, I think it's important to recognize that that's why vaccines can take a while to go from development to actual implementation, because we have to make sure that not only that what's being injected is actually harmless, but also that it creates those memory cells and that those memory cells stick around for a while. So that's why it might take 3, 6, 12 months of actual testing to ensure that the vaccine can work. And then on top of that, I think, touching on the fact, the creation of memory cells against COVID is important too, because we hear the phrase testing a lot these days. And initially when we tested, we primarily looked, or what we might call like antigen testing, where we looked at for something on the virus itself, so we can test if you have the virus. Whereas now we hear a lot about serology testing or antibody testing. And the antibody is actually something on the memory cell, which is unique to the threat that it's looking for. And so what that's the serology or the antibody testing is referring to is actually looking to test to see if you have those memory cells.
Right.
So until we really know if a lot of people in our population are able to have the memory cells, then it's tough to move forward, because until then we can't all respond to the virus effectively. So some really fascinating stuff relevant to today. And then on top of that, if we just go back to the immune system a little bit, talk a little bit more about what happens when our immune system isn't working well.
Yeah, so our immune system really runs as a scavenger system in the background. And it takes care of, growing cancer cells. It cleans up old non-functioning cells, takes care of any bacteria and virus that have kind of slipped into our system undetected. And we don't even know what's happening. So it's quite remarkable. But if it isn't working well, we become much more susceptible to things like cancer or illness or diseases from infection. We've also learned in recent years that many common diseases such as heart disease, neurodegenerative disease like dementia, and autoimmune diseases like lupus or rheumatoid arthritis are linked to dysregulated or imbalanced immune function. So we really need the immune system to be functioning optimally, but not over-functioning, because that can cause issues as well.
Right. So, obviously then, like, a poorly functioning immune system is in no means ideal. But what you really preach in your practice is that what we do in our daily lives and what our daily actions are can influence how that immune system works. How we sleep, how we eat, how we move, how we practice mindfulness. So can you talk a little bit more about how we can optimize our immune function?
Yeah, so when we look at the literature, there's a few really simple things that have been shown to make quite a large difference in how well the immune system functions. And I imagine you've already spoken about some of these things in different webinars, but they're really important, and I think they're worth speaking about over and over again. And the first is sleep. So the relationship between sleep, sorry, my walking slowing down. This is proving to be harder than I thought to walk and talk. The relationship between sleep and immune function is just in really the beginning stages of understanding. However, they appear to have a bidirectional relationship, which means that sleep affects the immune function and immune function affects sleep. And studies have shown that just one night of poor sleep can negatively impact the immune system. And it can take us over a week of longer sleeps to return to our baseline functioning. So it looks like on average, adults need 6 to 9 hours of quality sleep per night to optimize how well our immune system functions. If we do happen to get sick, getting more sleep can be essential to improving our response to defend against the infection. So ignoring fatigue and pushing through, continuing to go to work or what have you during the initial stages of illness can be very detrimental to your ability to recover. Your body really knows how much sleep it needs, so we need to listen to it. If you're tired, you need to sleep. The second thing that's sort of played out in the literature with regards to immune function is having a balanced diet. So in order for your body to do its job, you need to give it the fuel to do it. The metabolic processes that allow our bodies to function are super intricate, and having deficiencies in even one essential nutrient can throw off multiple processes, making us more susceptible to illness and disease. So when it comes to immune function, we know that certain micronutrients such as vitamin C, D, A, and the mineral zinc are essential for optimal function. In general, except for vitamin D, which we must supplement, we can get adequate levels of these nutrients from eating a diet rich in colorful fruits and vegetables and healthy proteins such as legumes, fish, and meats. That said, there's certain medications or medical conditions that make people more susceptible to deficiencies. So it's really important to check with either your dietitian or your doctor to ensure you're getting what you need from your diet. In addition to getting what you need, what you don't eat is almost as important as what you do eat. So a diet high in glycemic carbohydrates, like refined sugar, for example, and saturated fats from animal products impairs the immune system in two different ways. So high glycemic carbs actually decrease white blood cell function, and white blood cells are the most important cells in our immune system. This type of sugar also triggers the immune system to create low-grade inflammation throughout the body. And this can increase your risk of things like heart disease, and it also leaves you vulnerable to infection if you do encounter a virus, because your immune system's sort of distracted. It's busy doing other things. This is something I have learned recently, and I think it's super interesting. Your immune system actually mistakes saturated fat for bacteria. So if you eat a big fatty meal, your immune system can recognize that as it would a bacteria and mount a response against the food that you've ate that's sitting in your gut. So this can cause inflammation in the gut, which then can lead to leaky gut, which is an ineffective barrier. And if you remember back at the beginning of our talk, the gut is actually one of our very first lines of defense against foreign invaders. So we need those seals to be tight. Sugar and fat can also affect the healthy bacteria that live in our gut. And I know we've all heard lots lately about the microbiome, but these bacteria are really helpful because they aid in food digestion so that we have the nutrients that we need to fuel our cells. They actually produce certain micronutrients such as vitamin K, and they prevent harmful bacteria from taking over in our gut. There's also some evidence that they actually interplay with our immune system, kind of like a sparring partner. So they train our immune system, so to speak, which is really neat. Taking a probiotic can certainly help maintain the health of our microbiome and gut, but it can only do so much if our diet remains high in processed sugars and saturated fats and low in micronutrients.
Wow, that's really interesting stuff. And you bring up the microbiome, which I want to talk about a little bit further in a moment, although just to summarize, you talk about the importance of sleep, and it's fascinating to hear that even one negative fat sleep can impair your immune function that much, or maybe put another way, it can take that long to recover from just one night of poor or bad sleep. Probably either quantity or quality can be bad. And then, even speak to the part about your nutrition, and obviously on one hand, I think you emphasize, talk to your dietitian, talk to your physician about how you can really implement some of these things in your own life. But it really speaks to the importance of having that orange or having that apple and getting some micronutrients every day, and how what you eat affects your immune system, and even what you eat affects your gut. And you talked about the microbiome, and what we're coming to realize is just how much, not only what you eat affects it, but how you exercise affects it. And so, I think you brought up one thing, you talked about how our gut lining, and if you have a high fatty meal, the gut can be a little bit more leaky. And I'll think about how if you run a really long race, you start to see people whose guts become a little bit more leaky. If you've ever gone for a long run, I'll leave it at that. But it just shows how, on top of it, exercise really interacts with your gut and the microbiome. And for our viewers, the microbiome really just refers to the bacteria that lives inside of our gut. And I want to cover this more in another episode, maybe later this week. But again, exercise and the microbiome are also really, really intertwined. So given the interaction that Sarah talked about between what you eat and your immune system, it really speaks to how what you do for activity can also affect your immune function. So it just speaks to, again, what we've talked about through a lot of these episodes, is just to stay active, because we know when your muscles move, your muscles can actually release anti-inflammatory chemicals into the blood. So those can counteract poor immune function or boost positive immune function. And so with that, that regular activity can be really beneficial or really helpful for that optimal immune function. And so on top of that, not only is there the interaction in terms of inflammation, but also that regular activity can help how your nervous system works. And that, your nervous system controls how fast your heart beats, how your blood vessels expand or contract, how your gut moves, and so on. And so we have this thing called the neuroinflammatory axis. And so exercise, through not only directly, but also through then how your nervous system can really impact how your immune system functions. And I think it's important just to clarify, like, the activity doesn't always have to be really, really hard. And in fact, like, light to moderate activity is sometimes a lot more beneficial, especially like when we think about recovery and restoring the body to its natural self. Like, sometimes that light activity is actually a lot better than too intensive activity. I know, Sarah, we talked about it a little bit before. We won't really go into it too much today, but some people who do way too much heavy exercise, that can lead to a syndrome we call overtraining. And those people can actually become a lot more susceptible to illness. So people who exercise way too much and they do it way too hard all the time, they can actually get sick a lot more often. So really clarifying, like, that light activity, even like what we're doing today, just walking on the spot at a light to moderate pace, can be really beneficial for how your immune system functions. And on top of that, you know, if you're out for a walk in the woods, or maybe you're going along the seawall or out with the dogs, walking and light intensity activity can actually be quite meditative. So can you speak a little bit more to that last topic? So mindfulness and meditation and how that interacts with your immune function.
Yeah. It's interesting because in the past couple of years, I've really become the most interested in this sort of neuroendocrine axis that you were talking about. So how your brain, your thoughts, your emotions affect your physiology. Because when you have a thought or an emotion, you release chemicals and they flood every cell in your body. And that affects how your body works. So this is a growing area in science and medicine. And I think, you know, it's going to change a lot of things for us as we move forward. But for those of you who are unfamiliar to meditation, really what it is an intentional, regular practice with the goal of cultivating present moment awareness. So what that means is just being in the moment that you're in, not distracted by the past or the future. And studies have shown that meditation and mindfulness have positive effects on mood and anxiety level. This is really indisputable. And with as little as 6 weeks of practice, just 6 weeks of, you know, minutes a day of sitting in stillness or doing some sort of mindful movement, you can actually change the neural pathways in the brain to more coherent and healthy programs, which is amazing. 6 weeks is just over a month, so that's not much time at all. We know that anxiety and depressed moods can also have a negative effect on immune function. So studies are starting to show that mindfulness and meditation can improve immune parameters, and it's thought that the link is really through the improvement in mood and emotion regulation. A recent study that looked at young, healthy people who were non-meditators, who participated in a 6-week daily meditation program, actually had much better response to vaccination, so produced many more of those memory cells that we were talking about earlier than the group who didn't meditate. So, you know, as they move out into the world and they're exposed to different bacteria or viruses, they're going to have a more robust response and should be safer when they encounter these pathogens. And I know for a lot of people, mindfulness and meditation can be a little bit intimidating. You know, you're just sitting, but it's actually really challenging at first. So our dietitian, Heather Feldman, is actually posting mindfulness videos every Monday. And there's a ton of guided meditation apps out there like Headspace or Insight Timer that are free or give free trials right now with this COVID situation. So I really encourage people to check it out if you're not already doing it.
Yeah, I've played around with Headspace in the past, and then even more recently, if you've been to Heather's Monday video, I mean, it's almost been 4 or 5 weeks now that she's been posting it regularly. So maybe you're starting to see that benefit already, but I know even she did a fun one where you do the legs up the wall. So I really encourage you to try to tune into her videos and try them out and follow along with what she's saying, because it can help with some of that mindfulness and meditative practice. So overall, Dr. Clouthier, you've provided, again, so much interesting and valuable information for all of our viewers. And so just before we finish up here, I want to summarize some of the key points that you've told us. So first of all, you told us that, like, the immune system is really our body's defense system. And it's composed of 3 different lines of defense. With the first line is the physical barriers. The second line is that 911 first responders system that causes inflammation. And then the third line is the part that remembers threats. And so that's probably the system that's really relevant to our COVID crisis today. If you have poor immune function, that can make you not only more susceptible to immediate threats like viruses, but also long-term threats like heart disease, cancer, neurodegenerative disease, among many other things. But to combat this, there's a couple really simple things you can do. You can practice good sleep hygiene. You can have a balanced diet, thinking both about what you do eat and what you don't eat. You can stay active regularly and then practice mindfulness and meditation. And so, I mean, I might be sounding like a broken record because I've probably communicated those 4 things almost every episode thus far. But as boring as they sound, like executing in those 4 domains, it's going to make a huge difference for how your immune system functions and your overall health. And like, you know, given that they are in some ways fairly general tips, like that's what our integrated health team is here for here at Komen, to personalize your recommendations to your individualized scenario, whether it be our kinesiologist guiding you with how to move, your dietitian's helping you out with how you eat, or your physician and your nurses helping you out with practicing good hygiene, good sleep hygiene, good mindfulness. Like, please reach out to us because that's what your team is here for, to help optimize things like your health and your immune function, your well-being. So all this said, to summarize, Dr. Clouthier, can you, in your position as a physician, what piece of advice would you like to tell all your patients right now?
Well, I think, you know, the most important thing is you need to take care of your body in order for it to take care of you. And our health is really a byproduct of how we live. So all of the tiny little decisions we make day in and day out over a lifetime determines our health. And, you know, this isn't to, I'm not saying this to make anyone feel guilty if their health isn't where they want it to be right now. It's more a message of empowerment because we really do have the ability to change our health outcomes with how we live our lives. And it's hard to do that if you don't have the information or you don't have the support. So all of us on the team are here for you to help you with that. And you know what that plan looks like for each person will be different. Moving doesn't have to be on a treadmill. You know, it can be a nature walk, like Josh said. So prioritizing your mental and emotional health, which is something that, you know, we're not always encouraged or taught to do, really matters because that's going to affect your sleep. It's going to affect your food choices. It's going to affect your outlook on life, and that can literally change the trajectory of your life. So these little things matter. So I just encourage everyone to sort of think about what they're doing, you know, where they would like to be, and how you can make simple, tiny changes to get on that path, and just reach out if you need anything, because all of us here love helping with these things. So we're here to support you.
Yeah, I mean, that's a wonderful message. And I really think if there's a take-home message, as you said, you need to take care of your body in order for it to take care of you. And so with that, I'm going to stop walking. We've been going for about half an hour here. So you just did half an hour of great activity. Hopefully it helped boost your immune function, at least for the next little bit. I want to say a big thank you again to Dr. Clouthier for joining us. She's there again, shared so much valuable information. Go back, re-listen to it if you have to. And then, as we've emphasized at the end here, please don't hesitate to reach out to us. We are here to help and to help you make everything better. So once again, thanks for our guest, Dr. Sarah Clouthier, and I look forward to seeing you guys again on Friday.
Thanks, Josh. Bye, everyone.